You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Terrence, how are you?
Hey, I'm doing great. Doing great.
Good. Thanks for coming over. Um, I I'm impressed with your background, and I want to kind of showcase the audience a little bit about what you're doing and the purpose of what you're doing. Can you tell us a little bit, kind of an overview of where you started, how to get to it?
Yeah, no, absolutely. So, I started, I say, on ground zero in the hospital in the emergency department in outpatient registration, doing work around patient access. And then from there, I transitioned over to the physician side, did some management in cardiovascular medicine. Then my last corporate role was with Optum 360, doing revenue cycle management and electronic health record system implementations all over. But during that time, I saw there were major gaps in people getting connected to healthcare resources. And then when I looked a little bit broader, I realized, hey, and there are millions of people that are not even in the continuum of care and that are not even, that are, they're not even going to the doctor's office at all. They only go to the hospital when they get sick. So I said, how do we address that need? So in 2016 was when I started it with my first healthcare tech company called Connected Care, which managed referrals. We then moved forward to the consulting side and dealt with physicians. Then 2021, pandemic happened. I was like, okay, what can we do that can have a bigger impact? And I said, let's just bring the entire healthcare system to the community. So 2021, I founded Hyde Health, and I had our first event July of that year. And today, well over 120 plus events, kind of lost count. And that's what we do. We connect people to the healthcare resources through community health events of all different sizes. And then from there, the wraparound piece where we really close those gaps is we identify what types of needs they have. And then we go after different government grants, private grants, contracts, et cetera, and design health and wellness programs and implement those in the communities.
Yeah, I mean, obviously, this is a need in current society, and especially in the communities that, I imagine they don't have the resources or the knowledge of how can they get there. Um, how do you exactly do your model of business? Like, how do you organize fairs? Do you organize community meetings? What is the model of your business?
It's a combination of those things, and we like to use a collaborative approach. So we don't charge. All of our events are completely free. All of our health programs are completely free. And it may be a small scale event that we do monthly, like some of our what's called mini health and resource fairs. We do those every month at multiple libraries, senior centers, all across really the entire metro Atlanta area, across 4 of the 5 major counties. It could be, like you mentioned, the different workshops that we've done, like our digital readiness workshop for older adults, where we bring in older adults, teach them about technology, but then we also have health screeners and health resources there as well. Then it could be something like our hypertension management program, where these are, events that take place at these trusted community organizations like churches, schools. An individual can get their blood pressure managed and learn how to manage their blood pressure, get nutrition sessions on a biweekly basis. So it's a combination of those things that we put together, and we really depend on what we call ecosystem partners, like these major insurance companies, the community assets, the government agencies that fund us, and those organizations to really make it happen.
So for them, basically, you work with the insurance companies, right?
Yes.
It's a pay by insurance model, right? Um, I imagine there's a big savings for them by doing that, right?
Yes.
What
Yes.
is the advantage of using you as in your company as the intermediary between them and the people?
That's a great question. And, one of the big insurance companies we work with, I guess I can say their name, CareSource, they're all of our website, one of our big supporters. They're ones we work with very closely doing this. And they have what's called activation events. So we're able to assist them in having these activation events where it's like, okay, in this particular zip code, we have a huge population that we want to bring in. Hyde Health is able to come in, cut the costs out tremendously from a business perspective because we can put these events together, bring in our own vendors, et cetera. Then they're able to come in and provide well child visits like they've done before, or different types of screenings on site. So it's a tremendous, it's a great partnership for us because we're able to partner with these Medicaid providers in some cases. But then it's also, again, a tremendous benefit for them because they don't have to worry about putting their entire team together to orchestrate and do the groundwork of putting these events together and recruiting people to the events.
Interesting. That's a great advantage of having someone like you that can source those options for them, right? Um, I wanna kind of go back and see how did you come up with this idea? Like, what was the root of this idea for you, like a business idea?
Yeah, no, absolutely. So I'm one of those serial entrepreneurs slash go back to corporate when it didn't work. And that's why I told that story at the beginning about those different jobs. Because in between those, I'd always jumped out to do something entrepreneurial. And the way I came up with this one was it was a combination of the business, my first healthcare company that was called Connected Care, where it was a referral management company. And that was while EMRs were just getting big with referral management. And we were trying to figure out, okay, how do we link and really connect people to care, hence the name of the company Connected Care. So when I stumbled across social determinants of health and really getting to look into that, and that's when I kind of switched over to the public health side. And as I mentioned earlier, saw how many millions of people, 67 million people in America live in the primary care shortage area, right? And I'm like, these people are not even getting preventative care. So I'm like, how can we provide preventative care type screenings and events coupled with addressing the social determinants of health at these events and then getting them linked on the back end? And that's how the idea came about. It's evolved over the years. Fortunately, we have some great partners to really jump in with us, and then also just listen to the voice of the community. And they told us what they wanted to help us improve and get to where we are today.
Yeah, I was thinking the other day, I was in a, driving in a rural area,
Mhm.
and it came upon me the thought that, so many communities in the United States are isolated. Like you said, they don't have access to healthcare, but they also don't have access to a lot of things. They don't have access to grocery stores. Like many
Mhm.
of the communities and small towns in United States are like away from big grocery stores. I don't know how they eat, what they eat, and
Mhm.
how do they take care of their health. And this is one of the things that people don't realize, the fact that, like you said, the primary healthcare in this country is lacking. Like, we don't have enough doctors, but we don't have enough places where those people can go to access their doctor. What do you think the solution is here? Because you're the middleman there. How do
Right.
you see this solving?
Yeah, that's a great question. And throw just another number out there that I was want to put out there. By 2037, they're saying it's going to be a shortage overall, 187,000 doctors, and about 87,000 of those, 87,000 of those are primary care physicians. So that's one of the things we've been really intentional about is looking at the research and saying, okay, how do we leverage community health workers? And in places or states where community health workers don't have certifications or not that well known, how do we help support and advocate for them to be pushed to the forefront? Also, how do we get involved in policy to ensure that in as many states or as many places as possible, that these advanced practitioners like nurse practitioners and PAs can work to the full extent of their license? So that's what we're looking at, is looking at, what are all the alternative resources in terms of the individuals that can come in and help kind of, bridge these gaps. The other part that we do is, us going into these rural communities and saying, hey, number one, will you accept us coming in? Or, can we get your permission to come into your community? And if so, okay, who can we work with? And how do you all see these gaps being bridged? Is it helping you all, park, or where people can get fresh food, there are farmers that we can work with to help support farm to table program. So there's all different types of ways I think can be done, but definitely having community resources like how we use libraries and these types of schools, having these types of facilities being open to embracing health access and overall health, not just physician prior or clinical care, but the overall social determinants of health, and having them embrace these types of innovative models, I think is really what's going to be needed to actually address these disparities that exist.
Yeah. Now, looking back at yourself a little bit and the way you came to this point, you're a successful entrepreneur that had ideas of how to do this, but I'm sure you went through some difficulty, I would say, in your life, and maybe things didn't go too well, and you kind of, thought about, well, I need to get out of this mess and move forward. Can you give me an example of such a thing?
Oh, absolutely. Like I said, there were times where I had kids young, got married young. So there were times where it was like, look, this is not working. I have way too many responsibilities, and I'm just going to have to kind of put this to the side, and you make it a side thing or to start over. So that happened, a few times. But I think that's where the different adversities like that, and the different times where things actually end up becoming lessons. As I like to look at them versus failures, those are those opportunities where I was able to actually sit back and take that introspective look. So then the next time I tried it, I said, how can I do something different? So, this is not bringing any money in. I need to be honest with myself and realize, hey, this is not generating revenue. This is still in the hobby stage and it's staying that way too long. Let me figure out a way to make some money while I can then, be relaxed, not stressed out about paying bills, and be actually able to generate revenue through a revenue generating model business. And the other part was just going back to my grad school roots of looking at the actual business model and saying, okay, is what I'm creating something that the market is actually demanding? So, just a lot of that introspective and being real, speaking to mentors is how I kind of overcame those challenges when things didn't quite work out. And I had to kind of, sit on the sideline and figure out another strategy before coming back in.
Yeah. Um, you know, we, you're talking about revenue in your business. You know, one of the hard things for entrepreneurs, especially in this medical field, is to make the numbers work, not for the business itself, but for their own self, right? Because you're a self-employed, basically running your own business. How do you manage finances the way that you need to be comfortable? You have a family, you have kids, you need to look for your future. You know, there's so many challenges of working for yourself in this field. How do you structure your finances and your future?
So for me, it's about being as frugal as possible while still just living life, right? So you don't want to miss out on too many opportunities, because you never get a day back. But at the same time, are there sacrifices that can be made in the short term that are going to benefit you, long term? So that's kind of how I look at it there. The other part is looking at the diversification of revenue streams and how I can kind of incorporate that in my business. So for example, we may be doing, presenting health fairs. There's also an aspect where I can come in and do consulting, which brings in, generates a lot more revenue a lot faster sometimes. And I can still incorporate what the core business of Hyde Health is while bringing myself in and other individuals like the interns and the contractors that work with us, while bringing them in on consulting projects to be able to address a larger scale clients. So it's just a combination, those things, and sometimes some lucky breaks. Definitely, the different speaking opportunities and engagements and things that come up. I'm like, okay, this is okay. This is a way to keep things going that way. So it's a combination of those things is really how.
Yeah, it's you need to be a hustler,
Yeah, absolutely.
to
You
to
have to
be
be
on your toes all the time.
all the time.
It's not easy to be an entrepreneur in healthcare, and I imagine also things are changing, right? Like I'm looking years ago when the concept of having health insurance was passed by the Congress in a, broad, widened field, so everybody can have access to it. Now things are not the same,
No.
and politics already, play a big role in these things. What do you envision
Mhm.
happening in the next few years in this field?
I'll definitely take a wild guess, but I'll say truthfully, I have no idea. I've been trying to look at different models and read. I'm looking at research. Like, okay, what could happen? But things have been taking so many turns that I'm honestly not sure. I know what I hope happens is that people keep access to things like health insurance and they keep access to these different healthcare services. But unfortunately, as we've seen, over the past few months, hospital closures in rural areas specifically, like we were just talking about, those are mounting up, and it doesn't show any sign of stopping. I've been looking at that, looking at the larger hospitals that have been cutting back on services. So, unfortunately, I feel like we're headed towards some really tough times, and that's where where it's up to different individuals and actors in the community to say how can we come together to really brace for this and then help address that. But I do feel like there's a light, at the end of the tunnel because I think there are a lot of innovators out there and there are benefits in technology. There's actually benefits, in a lot of the AI technology that exists that I think, is going to come to the forefront over the next several years. But, to be determined, I guess I'll say that.
Yeah, it was a tricky question.
Right. It was. Definitely.
But I know it's a wild guess. I agree. All you can do is to kind of try to put people together, like you said, Um, now, you came to a good success in what you're doing right now, and you gain a lot of experience. You work in different fields. You had a couple of companies. If you would look back to your own self when you started this whole thing,
Mhm.
what kind of advice would you give to yourself?
I would definitely say slow down. That was one thing I heard along the way, but I guess we was 19 when I started my first company, so right there, the world's endless. I'm gonna, I'm never gonna die. All those things were going on. It was like, and I don't have time. I have to hurry up. But now, at 36, looking back at it and realizing, wait, I'm still kind of young, I think. And over these years, had I slowed down and seen certain things from different perspectives, I would have made different decisions. And so I definitely say, from the slow down perspective. And then the other part is to go out on a limb. I think there were times that even though I was being, really aggressive and having that entrepreneurial drive, there were times I could have taken, bigger chances or gone after, had relationships with bigger organizations or people who are at different levels who probably could have, helped my career, speed along or could have given me guidance or mentorship that I may have missed out on. So I would say those two things.
Yeah, nice, nice. Now, what do you want to accomplish now this year? What's new for you? What do you want to do with your company? How high can you go on health?
Yeah, that's a great question. Great question. So, one of those things is expanding to several. We've only put a number on it, but several rural areas. We've only done one rural event, which is in my hometown. That's considered rural in Georgia. So we did that a couple of years ago, and then we have another one that's coming up next year. We haven't announced yet. So we want to be in a certain number of those by the end of the year, because the metro area, we've done again. That's where 100 and some odd events have happened all across the metro Atlanta. So going into these rural areas, but then also further developing these strategic partnerships with these different innovative groups. So because of the change in the political climate and the funding environment from the government funding perspective, et cetera, we've been able to now start to have conversation with groups that I didn't even know were paying attention to us. And we're like, hey, we want to talk to you all. Or groups that are kind of, you wouldn't necessarily attribute to healthcare directly or health overall. And you realize, wait, there's a huge benefit to what this organization provides. So really solidifying those partnerships over the next several months. This last quarter of the year is what we're looking at doing.
Interesting. Yeah, we're actually taping this interview the day after the government shut down because of a healthcare issue.
Yes.
So it's interesting how these things evolve. What is the implication? And obviously we don't know what's going to happen and how long this is going to take. But from your point of view and your perspective of what you're doing with your company, what do you see happening because of this?
If premiums do go up to the extent that they're saying they may go up, millions of people will be without health insurance. It's not a political statement; it's just a factual statement of what will happen. When you attribute that to the different job losses and things going on with the economy, people's finances are changing. So I'm saying that to say now is the time more than ever for groups like mine and just other organizations and individuals who say, hey, we have to figure out ways of collaborating. Now is the time to come and be that net, if you will, to support and catch those individuals who fall, even further out of the continuum of care. I also think, mental health is another thing that's going to be tremendously on the rise, already was on the rise, but that's definitely going to increase when you look at job losses and the stresses that come with financials in people's lives. So, us being a company that focuses on mental health as well as other chronic diseases, being there to figure out ways of how do we keep people in the best mental state as possible, or connect them with whatever resource we can, in any innovative way that we can with the resources or the funding that we have available. So,
Yeah. Terrence, how can people reach out to you, know more about your purpose, your goals, and your activity?
Yes, I'm very accessible. Our website up there, I guess on this side in the top corner. So www.hyde.health.com. You just put in Hyde.health if you want. I can be reached there. And then on all social media channels, my full name. So Terrence Hight Jr. At Terrence Hight Jr. on LinkedIn, Instagram, TikTok, wherever you look, I'm pretty much there.
Very nice. Thank you so much for coming over. I think you're doing a great job with this idea, and I hope your company will succeed in your purpose of moving this towards something better.
I appreciate the opportunity. Thank you so much.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.